everyone, my name's Lainey Laxon, and this will be my first YouTube video, so please no comments about it. I'm not good at this. My daughter was a YouTube video guru, little expert. She tried a while in her young teens. Sorry, that's Maestro. That's our little doggy. He's probably going to make a grand entrance later. He loves to do that at the right times when we're recording. But anyways, this is about my journey with breast cancer. And so this is basically my first YouTube video, like I said. And so it's not going to be perfect. I'm still learning how to do this. And so this video is primarily about what I'm experiencing right now. And this will be exactly 1 week anniversary after I've had my exchange surgery. And basically what an exchange surgery is, when you have a mastectomy, sometimes some women choose to have the breast reconstruction done at the time the mastectomy is done. And what they will do is they will put expanders in, which are called tissue expanders. And basically they're basically like a, I can't even describe it, but they allow the breast to maintain the shape so your skin doesn't, you know, heal and go back down to, I don't know, guess being flat, so that when they can increase it with the saline solution or the filling that they use, they will expand it every time you have a follow-up with your plastic surgeon to whatever size you had both agreed on before your surgery. And so basically I had my exchange surgery done, like I said, a week ago. And even though I may sound like I'm so nice and cheery, that's usually my personality. I've worked through my cancer and pain, and some people could not even tell I was in pain. So right now I'm actually feeling some discomfort. I stopped taking my painkillers because they were making me nauseous, and so I'm just taking Tylenol right now, and so it doesn't really do anything for the pain, it just numbs it. The great thing about the painkillers was it not only took away the pain, but I was able to sleep most of the day, which was good for healing, but just made me nauseous. So I'm just dealing with the discomfort right now. And I can't really describe, when I'm trying to describe how it feels versus the expanders is very different. When you have the tissue expanders in, you can pretty much, after you have your fill, you can push your finger down onto your breast, and it feels like, if you've ever felt like a plastic, you ever seen those when you get those things in the box, and they got those little airbags in there? That's what it felt like. You actually can push and you can feel like not much resistance. You can feel like there was something like a bag of filling. So that's why, you know, it's not your permanent thing because it's not really filled with anything but some kind of saline solution that they use. So anyways, when you do get your implants put in, mine were silicone implants, which I have right now. So there is a big difference. You can actually tell, obviously, because it's silicone. So it's, you know, it's not no more saline. It's dense. I mean, it's thick. You can feel it. There's some mass there. But as far as how it feels, it. Okay, that's our little dog. Sorry. It hasn't fully healed. Like I said, it's only been a week as of today. So when I move around, whether I move, if I'm getting up too quickly or I get down, or if I'm laying back down too far back, it doesn't feel right. It feels like, I can't, the best way to describe it to my family, it feels like a suction. Have you ever had like those suction cups and you put it on your skin and it kind of like, or you put it on like a shower or glass and you have a little suction cup? That's what it feels like. And it feels like it's like some kind of suction that's kind of moving. Well, I can't say really moving, but you can tell there's something there And I guess that's because it hasn't really healed right now. So pardon me if I'm looking down. I'm trying to look at the camera and I'm looking here at the computer just to make sure it's focused. But anyways, that's how it feels. And so as far as if there's questions like, how does it feel? Does it feel the same? I got questions before on my Instagram. Does it feel the same as when you had the mastectomy? Or it's a different kind of feeling. Like I said, the mastectomy was worse because, of course, you just had your mastectomy, whether it's a single or a bilateral mastectomy, or I had bilateral mastectomy, and with delayed immediate reconstruction. So that's a lot to go through in your body's trying to heal from it. And this is my stroke. So the pain was way worse, obviously. But with the tissue expander exchange surgery, it's a lot shorter, the surgery. And I think mine was maybe about 2 hours, or an hour and a half, or hour 45 minutes, but less than 2 hours. Because they basically, well, my plastic surgeon basically went under the breast right here, and where they actually inserted, where they had the mastectomy, and we just reopened the scar. And so by reopening the scar, it just reduces more the scar tissue and all that. It just makes it better for me, aesthetically. So anyways, yeah, so that's the best feeling I can describe for it. Like I said, I still sleep at a 45-degree angle because when they discharge you, or when you have a mastectomy, or they usually have you sleep at a 45-degree angle during that time, because they don't want you sleeping flat on your back, obviously. And so the same thing goes for after I had my exchange surgery. I still sleep, of course, at a 45-degree angle, because that was the instructions given to me by my plastic surgeon. And to be honest with you, I like to sleep on my side, but ever since I've been having, going through my journey with breast cancer, I've actually been able to sleep at a 45-degree angle, but it actually feels way better. It's more comfortable for you. So I'm trying to think what else I can say to describe this. Maybe when more than a week has gone by, it won't feel as weird. So going back to what I was saying, how does it feel? This is just my personal feeling, and I probably got a lot of the medical terminology wrong in what I was saying, but I just wanted to share my experience and what I was feeling, so other women who are, or men, would like to know how it feels after you have the surgery, whether it's the mastectomy surgery or the expander fills. This is just my personal experience. And I like to go back on what, I think I had said something earlier about after you have your fill, you can push your finger down and it feels like a air bubble pocket. Actually, I meant to say I don't have anything written down or scripted here. I'm just speaking normally, just right off the top of my head. So I meant to say, when you actually have your fill, it's very firm. It's very taut because they're expanding your skin to stretch and muscle, so that it stretches to make way for the future implant size that you've selected. So it's going to be very firm and very tight, and they're going to give you some kind of medication so that it feels it's the muscle tightness is not going to be as tense as it is after you have your fill. And then after a few days, your skin will accommodate to the stretching and the muscle stretching, and then it's going to kind of, like, I don't know if that's the best word to say, but settle, and it's going to feel not as tight, That's why I meant to say when you can actually push down, it feels more natural, not as firm. But I had a lot of, I'm sure I'm not explaining this correctly medically, and everybody has their different path and treatment plan that they have with their plastic surgeon. I was supposed to have additional treatment done, or reconstructive done at the time of my exchange surgery, but that was going to be postponed for later for now. So the surgery time was probably going to be, estimated time was a lot shorter than what was my plastic surgeon told me the first time. But anyways, so sorry for the unprofessional editing. I didn't even try to edit this because, like I said, this is my first YouTube video, and it's late. I'm tired, and I'm new at this, and I'll probably get better at this later on the more I do these videos. But I do want to say everybody has a different treatment plan with their doctor and plastic surgeon, and I just want to say that I hope everybody that's going through this, you're never alone. There's a lot of other women and men going through this, and you have family, and if you don't have family, there's a lot of resources you can probably go through. There's support groups. Sometimes the hospital has support groups they can help you with. Other women that are going, or slash men, women and slash men that are going through breast cancer. There's groups that you can meet with, and so you're never alone. Don't ever think you're alone. Always think positive, you know. And I know it's hard to say, you know, I'm not going to try to cry, but, you know, you just have to think positive and just get through it day by day, you know. And so that's it for now, and good night. And sorry about this. I'm not going to edit anything because I am, one, tired, two, too lazy to edit, and I can't figure it out. And I just want to post this and get this over with. But thank you for watching, and hopefully you can subscribe for my future videos along my personal journey. And prayers to everyone, and prayers for everyone going through this, and prayers for healing and a smooth recovery for everyone. Okay? So anyways, I am on Instagram. It's me_versus_C, which basically stands for me versus against cancer, C for cancer. You can also find me on Facebook. I have a Facebook page. I just don't have a actual web page set up because, like, I've been going through this. I've had 2 major surgeries within 2 months, and the first time after my mastectomy, I was very fatigued. I really didn't get to heal fully before I had my exchange surgery. So anyways, thank you for watching. That's it for tonight. Thank you all. Bye-bye.